we will move to the kidney stones. That is another section that you are supposed to study. You may have some idea regarding what is a kidney stone and how it affects a person and what are the normal difficulties the person will be having. Sometimes stone may be very small, then it may not create too much problem. Sometimes stone may reach the size of this much size, so then it creates a lot of trouble for the patient. So kidney stones are the result of buildup of dissolved minerals on the inner lining of the kidney. Here I will show you. This is how the kidney stones will be appearing. Almost like a normal rock. So these rocks are actually formed of calcium oxalate. There is a just like sodium or sodium chloride crystals. You can also think this like a crystal made up of calcium oxalate. That is a chemical composition of this kidney stone is mostly made up of calcium oxalate. See here you can see that it is blocking the passage inside the kidney. Here this is the main passage which we call by the name pelvis or hilus. In the pelvis, most of the recollecting tubules or renal tubules will be finally opening and discharging or releasing their urine here. It is from the pelvis this urine will be finally taken down to the urinary bladder. So if there is some kind of stones there, what will be the effect? It will be blocking the passage of urine. So the person may not be able to pass urine or release urine, so that he will be having a lot of difficulty. At the same time, because of the presence of the stones inside the renal, inside the urethra or in the pelvis, it also causes intense pain, both inside the kidney and sometimes in the urinary bladder also. So these are the major difficulties of kidney stone. It is mainly formed of calcium oxalate, but some other mineral compounds can also lead to the formation of kidney stone. So as a rule, kidney stones are usually formed of calcium oxalate. That is a main type of crystal that we are finding in the case of a kidney stone. See here you can see that they can be very small like less than 1 centimeter in size. But they can also grow very big like a cricket ball or a golf ball. So that much is that much the size of a kidney stone can reach if it is not treated properly. So kidney stone can grow to the size of a golf ball while maintaining a sharp crystalline structure. In this picture you can see that sometimes the kidney stone may be very polished. It may not be the case all the time. If the kidney stone is always appearing like a normal rock with very sharp edges, then when it is moving down, what happens? It will be causing tearing of the skin inside, and that will be causing bleeding, and that blood will also come out through urine. So this is the problem with the kidney stone. Sometimes it causes internal bleeding. Internal bleeding is mainly caused by passing of kidney stone down the urethra into the urinary bladder. So that is how the kidney stone can create a lot of problem. The stone may be small and pass unnoticed to the urinary tract. If it is very small, for example, it is less than 1 centimeter, then most of the time person may not be aware of it. By passing the urine, it goes without any notice. But at the same time, if it is increasing in size, many small stones are joining together, or the stones gradually increasing in size. Then what happens is that it becomes very large, so that it cannot even pass through the urinary urethra or other urinary bladder or urethra. So that will be leading to intense blocking of the kidney, urinary bladder, and the urine will be accumulating. So the person will be experiencing too much problem. So this is how urinary kidney stones are usually leading the person into a state of severe pain. See here you can see that how much the size of the there is a scale here, and you can also see how much the size of a normal kidney stone can come. Many kidney are half an inch in diameter. So the size or the width of the kidney stone usually around one half an inch. Sometimes it can reach up to 1 inch also. So this is how. So here also you can see that the kidney stones are usually having sharp pointed knife-like edges, so that it can cause internal bleeding or internal injury or tearing of the flesh there. So that will be cause leakage of blood. That blood can also pass through the urine. So what are the symptoms which are normally associated with kidney pain? As I told you in the beginning, severe pain, groin means your hip region, that is a groin, or because most of the kidney is around this region. So then blood may be present in the urine, because if these kidney stones with the sharp edges are causing tearing of your flesh or tearing of the internal skin, then blood will be leaking out. That blood can come in the urine. Then vomiting as well as nausea. Nausea means okan, and vomiting. So both can happen. Then why WBC or pus in the urine? Normally a few WBC can be present in the urine, but too much amount of WBC or white blood corpuscles or pus cells can also be present in the urine. That is another indication. Then reduce the amount of urine excreted, because when a blocking like this happens, the person may not be able to pass urine or release urine, even though urinary bladder is full. Because of this problem, because of the presence of these stones blocking the passage, the person may not be able to pass urine, and that will be leading to intense pain and intense discomfort. Then burning sensation during urination. Burning sensation means because of this presence of these sharp edges, sometimes the stones may be moving down, and if it is causing any tearing of the skin, then while passing the urine, the person may experience severe pain, and that is known by the name burning sensation. And while passing the urine, then frequent persistent means constant, frequent desire to urinate, because the urinary bladder is never fully emptied. Then the person may have a lot of urine still remaining even after going for a urination. Then, and if there is accumulation of the urine, what happens is that sometimes bacteria can infect, and that infection can lead to a urinary tract infection. Then fever can happen, and along with the fever there will be shivering, there is chills. So if any kind of bacterial infection is associated with kidney stone, it can lead to fever and associated problem. So this is how the kidney stones are usually creating problems for the patient. So remember that it is a type of stone mostly made up of calcium oxalate, and usually it is having sharp edges, and sharp edges can cause tearing of the internal skin, and that will be leading to the leaking of blood, and blood can come out, may be present in the urine. Then intense pain will be present, and these are some of the common problems associated with the what is called kidney stones.